So Fred, what can a person who's newly diagnosed with MS expect the future to bring?
Well, it's very hard to predict. As you know, MS is the most variable of the serious neurological illnesses. It can go from extremely mild, so mild that some people never know they have MS, they could live their whole life with it and never know they have it, to being very severely disabled and everything in between. The course that MS usually runs, as you alluded to earlier, is attacks, these flare-ups, exacerbations, relapses that occur at random times over the course of the illness. They could occur weeks apart, to months apart, to years apart, to decades apart. And each attack is something new or a worsening of something old, so new numbness and tingling, new loss of vision, double vision, all the others, that lasts for usually several weeks and then improves. It improves anywhere from completely to partially to not at all, and then you're left with whatever you're left with, maybe a little bit of a limp or some persistent numbness or some pain, and it goes along until the next attack, and that's what's called the relapsing remitting form, and that's the commonest form of MS. And that may be all that ever happens to individuals. They could have 1 attack, 2 attacks, 10 attacks.
What percentage of people will have that relapsing remitting course at the beginning, at least?
Probably about 85% will have that at the beginning, maybe even a little more. Some of those individuals will then go on to a progressive phase where in between the attacks, or even in the absence of attacks, they'll gradually worsen over time. Not at the same rate, but just little by little they get worse, and that's called the progressive phase of the illness. And if they started out with attacks, then it's called secondary progressive MS. And the concern with the progressive phase of the illness is that people develop disability during that phase.
Is there a particular nature to that disability typically?
It most often affects walking and balance, but it can affect other areas as well. Some individuals will never have attacks to start the illness, but will start with the progressive phase, and they're called primary progressive MS. And again, that most commonly starts with walking difficulty and trouble getting around, but it also can start as uncommonly effects on intellect or cognition and also coordination. Those individuals, again, gradually worsen, and that's a more worrisome phase of the illness because they tend to accrue disability over time, and we don't have very good therapies.
A lot of my patients, when they're first diagnosed, come in and say, "Doc, am I going to be in a wheelchair?" How do you answer those patients?
I tell them I don't know. I mean, that you just can't predict. Actually, I tell them my crystal ball's in the shop because it doesn't work very well. Most people these days don't end up in wheelchairs, and I tell them most people don't. There are some prognostic issues that could give you some rough guidance as to who's going to do better, who's going to do worse, but they're not particularly reliable at an individual level. They work very well for looking at groups of individuals. So as you mentioned earlier, people come in with sensory symptoms, tend to do better than people who come in with trouble getting around, walking symptoms and such. People who lose vision in one eye, optic neuritis, tend to do better over the long term than some of the others. Women tend to do better than men.
But as we look around our waiting room nowadays, we see lots of healthy patients. So I think we have the feeling that the medications that we have now might be changing the prognosis for the better.
We certainly have that sense, and I think most of our colleagues have expressed the same sentiment that we're seeing less. So I think the important message here, what you're getting to, is that MS is unpredictable, but it's not predictably going to cause disability or severely affect one's life. It could, but it's certainly not guaranteed, and the bulk of our individuals lead very normal, very productive lives. They have children, they raise families, they finish their education, they start working, they get out into the community. They overall do very well.
Can people expect to live a normal lifespan, or can MS be fatal?
MS is uncommonly fatal, and lifespan is shortened to a very small degree, and that keeps changing, and so it's harder to get the numbers as you go along. But it is not generally considered a fatal illness.